I'm Gary Vander Ark. I'm the president of CCMU. I came to Colorado in 1970 to begin the neurosurgery service at what was then called Denver General, now known as Denver Health. And I spent 6 years working at Denver General Hospital, and it instilled in me the feeling that everyone in the United States should be able to have absolutely the best health care possible.
The history of CCMU is one of the favorite pieces that I get to talk about. We started as a project at the Colorado Medical Society out of a deep-seated recognition among the provider community that people had different access to healthcare services and that there should be a conversation about that in the state of Colorado. And so as we moved through the project-based work at the Colorado Medical Society and then transformed into our own standalone nonprofit, we really have always kept the connection and the focus on both the patients but also the providers and systems of care that are dedicated to serving the underserved. All of our safety net clinics and community-based systems of care that come together every day to find ways to get care for people who need it.
I feel like the biggest impact that CCMU is making right now is bridging between policy and the community, just making sure that whatever healthcare policies we make are connected to the community and vice versa.
I think the most important thing is the people who have been involved in trying to solve this substantial problem.
We have an outstanding, dynamic board of directors who are some of the best minds in this work. I have staff that I get to work with that are the best and brightest.
So many people across the state are doing the same work. They're all grappling with the same issues, grappling with the same problems. And to have a coalition like CCMU to weave all of those issues together and talking to people, going out into communities and garnering the power of community residents and community members, I think is really valuable.
Well, CCMU and South Metro Health Alliance go back to the year 2009. And in 2009, we formed a strong partnership. Actually, CCMU is our fiscal sponsor. Without CCMU, SMHA would not be here.
A number of people, as I've been preparing for our 15-year celebration and asking questions, they all remark on the people that were involved and the long meetings and the true hard work that was done to figure out new paths forward.
A lot of things have changed over 15 years. The one thing that hasn't changed is the mission, and that has just been clear. The people who have been gathered around that mission, the faces have changed somewhat. The work that's being done to further the mission has evolved a lot over the years, but the mission has stayed the same, and we have this dream of what this is going to serve, but the work is not done, and there are plenty of people still passionately involved in making sure we get to that point.
Well, I wish that the mission of CCMU would end and that we would accomplish our goal to have all people have access.
We have the chance to reach out and talk with people all over the state about this shared issue of health.
I think being a coalition offers the opportunity to listen to many different voices and to do that and to learn from each other and also realize the commonality that we share in our goals.
Even though we may fail to meet a specific goal, we will never ever give up in our fight. That's why the motto of the Coalition for the Medically Underserved has always been, we can, we must, we will.
I'm very hopeful about the future of CCMU because I believe we have a broad commitment across the state of Colorado to solve the challenges that the citizens of Colorado face in getting the care that they need.
We still need to complete our goal of achieving access to health care for everyone in the state of Colorado. We will never fold as an organization until we achieve that goal.